Good morning. We would like to ask and invite everyone to start making their way to their seats. Please don't be shy and help us fill in the seats in the front. Make a new friend. As we are settling in this morning, I would also like to invite you to please silence your cell phone or any other device that makes noise. Thank you. Before we get started with our program, I'd like to let you know that there will be some pauses during the program this morning due to air flight traffic, which you will hear. So we will pause in our remarks so that you can hear us as we're sharing our news this morning. I do want to make sure that you know, though, that you will not hear these sounds as a patient or visitor at Sierra Medical Center. There will be superb soundproofing there. So we will begin our program this morning, and I will ask you to please rise and enjoy a color guard presentation by the Girl Scouts of Sierra Nevada, Troop 1473, followed by the singing of the national anthem by Jessica Pauletto.
Can I touch it? Is that okay? Okay. Color guard attention. Color guard advance. Color guard post the colors. Ladies and gentlemen, the flag of our country, please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Color guard retreat. Thank you.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Thank you to the Girl Scouts and Jessica. Thank you so much. Good morning. Good morning. There we are. Thank you for joining us as we celebrate the groundbreaking of Sierra Medical Center and the expansion of Northern Nevada Health System. Buenos días. Gracias por acompañarnos esta mañana para celebrar la inauguración de Sierra Medical Center y la expansión del sistema de salud del norte de Nevada. We invite you to capture today's festivities and share your experience with the hashtag NNMC Expands. Looking forward to seeing your content there. My name is Vanessa Vancour, and I am so pleased to be here today as we mark a new milestone in health systems journey. I have called Reno home for 13 years, and I have been witness to an incredible growth and transformation in our community. As a faculty member at the University of Nevada, Reno, I have had the honor of working with young professionals as they embark on their careers. And I am also privileged to serve on a few nonprofit boards in our community committed to making our community healthier. And today, we are here in anticipation of a new development that will contribute to improving the health of our region. I am pleased to introduce Carla Perez, Regional Vice President of the Western Region for Universal Health Services.
Hello, everyone. It is an incredible honor to be here, and I want to thank all of you for coming out to celebrate with us. Today, you will hear about the significant growth our region is soon to experience. In fact, the last time our community witnessed an event like today was more than a century ago. Healthcare in this market has certainly evolved since that time, and Northern Nevada Health System is now at the helm of a significant project. Before we proceed with today's remarks, I would like to recognize a few very special individuals that have helped spearheaded Sierra Medical Center's groundbreaking and really up through the entire process that we've gone over the last couple of years to get to this point. First, Alan Miller, our founder, chairman, and CEO of Universal Health Services, who you will hear from later. Although not present today, Mark Miller, our president of Universal Health Services, has played a critical role in our strategic growth plans. Marvin Pember, the president of the UHS Acute Care Division. The City of Reno Mayor Hillary Shivey, who could not be with us today, but we certainly thank her. City of Reno Vice Mayor Naomi Dewar, and the Reno and Sparks City Councils, and all of those members who we presented in front of numerous times, and we thank you for your support of this project. As well as representatives today from the Office of Governor Steve Sisolak, Kiera Bracken, Bill Chan from the Office of United States Senator Catherine Cortez Masto, and Nate Helton from the Office of U.S. Senator Jackie Rosen. We thank all of you for representing today. On behalf of Northern Nevada Health System, we appreciate your support and the hard work of your staff, which has led us to today. I would like to now introduce Alan Olive, the Chief Executive Officer of Northern Nevada Medical Center, who is the dedicated leader behind the successes you have witnessed and those yet to come. Alan has shown his commitment to improving the health of our region and has built an incredible team who is focused on patient care and exceeding quality and safety standards. In fact, I'd have to say, I don't know anyone who is more passionate about delivering high-quality patient care, and it is incredibly evident with the work that he currently does today at Northern Nevada Medical Center. Alan is a native Nevadan whose passion for his community has been seen throughout the entirety of his career. With over 25 years of healthcare leadership experience and numerous positions held on local nonprofit boards, he has dedicated his time to advocating for access to top-tier quality outcomes and safe patient care. Please join me in welcoming Alan Olive.
Thank you, Carla. I appreciate that. I want to start first by thanking really someone who made this event possible, and that is Jamie Ubaldi. Where are you, Jamie? This is Jamie. So Jamie's the workings behind all of these this event, and we sure appreciate her leadership, as well as with Roselle from our corporate office, who made a lot of this possible. So good afternoon, and really, again, on behalf of our entire team, thank you so much for being here. It's exciting to see you all here. I've never had a cheer like that before, except for when I think I was going on vacation with my kids saying, "The house is ours." So. But we're really honored to introduce the groundbreaking event of Sierra Medical Center and the growth of Northern Nevada Health System. For decades, we have been committed to the health and well-being of this entire region, and we're so excited that we can extend this through Sierra Medical Center and the growth. We do pride ourselves on the quality care and the outstanding results we currently receive at Northern Nevada Medical Center, as well as with Prominence Health Plan, our outpatient clinics, Northern Nevada Medical Group, and other facilities such as Quail Surgery Center. And it's really because of you, a lot of the providers in the room, and our team of providers at these centers. In the years to come, we will continue to improve and expand on these services, and we're excited to take this new venture with you at the groundbreaking here at Sierra Medical Center. You know, for me, this is a personal journey because I was born and raised here. I try not to get emotional because I got my family right here, so. So got the emotion out of the way, so we're good to go. But it's a personal history for me because I was born and raised here. I was a Brown Bear, Brown Elementary. Do we have any Brown Bears here? Okay. I was also a Worcester Colt graduate. Any Worcester Colt graduates here? Got four in the entire room. Okay. Okay. So it's an important about our community and sustaining our community. And this, today's event captures a moment in time as well as a journey forward of how we sustain our community going forward in healthcare. This is the largest investment in healthcare this region has really ever seen, at least in a number of decades, and perhaps ever. And we're very grateful for the really outstanding leadership and guidance from our corporate team and founder, Alan B. Miller. So I want to give an applause for your leadership. So this journey started with Northern Nevada Medical Center, built nearly 4 decades ago, and it provides the foundation, again, for a health system, Northern Nevada Health System, and its wraparound services. In addition, again, we've mentioned Prominence Health Plan and Prominence Care Centers, which already provide some unique services that address our population health needs for our community. And it's really exciting to have them in this community and sustain that environment, as well as innovation and delivery of primary care. And because we focused on health and wellness and the healing of patients of all services and programs within our system, it's required us to really adopt excellence in all that we do. Our staff, and a number of them are here, and last night we had a big celebratory event with our staff as well as many other providers and physicians. They really hold a high standard and a benchmark. In fact, they exceed those benchmarks in all that they do. In patient experience and quality of care, they're very passionate about that, and our physician leadership and provider leadership is likewise very exemplary in that area. And we're proud at Northern Nevada Medical Center today. We're one of the few hospitals in the state that have received the A grade. That's the top grades for all of us who went to school. by the Leapfrog organization. It's an organization that measures quality and safety. We're also the only hospital recognized by the Hospital Engagement Network to receive the award of Safety Across the Board for Premier. What that means is they measure even more than Leapfrog does, and we're the only hospital in the state of Nevada to receive that award, and only one of 27 in the entire nation. So that's really goes out to our providers and our staff. So as we look to the future, there is great opportunity to improve healthcare in this community. And I remember a discussion years ago. We had in fact, there's a number of you in the room, our physicians who came to my office and said, we need something different. We need something that really addresses the growth, but also the type of care that we provide in this region. And because of that conversation, it led to actually a conversation with Marvin Pember and Carla Perez, who said, okay, what are we going to do about it? Well, this is what you started, so thank you. So as we sit here today, I like to visualize things. And so as we sit here today at the groundbreaking of Sierra Medical Center, I want you to visualize what this means. So we intentionally named it Sierra because of where we live. This is a place where we bike, we hike, we camp, we fish. We mainly swim in Tahoe when it's warmer, but it's a great adventure to catch a breath. But it's about what we breathe, and it's how we live in this region. So I want you to envision that environment, bringing it into Sierra Medical Center, a center that helps us also live and breathe. And so the design of Sierra Medical Center was intentional, and I'd like to share with you some visions and views and renderings of that. And we're grateful to have a team of our SR Construction here and our subcontractors, again, local providers of those services. So let's take this journey. So this rendering is actually a rendering from Albert Bernstad, and it's from 1868, long before any of us were born on this earth. So it's a rendering called In the Sierras, 1868, and he captured a lot of things in the Sierras. You can see Yosemite in this picture. You can see a lot of other things. And so it's really exciting to see that our corporate team, as well as our architects, took the name Sierra in a really in-depth way and found that we're going to use this palette to incorporate that into the design of the flavors of the outside as well as the inside of our facility. You may recognize some of these pictures. This is a lake palette used, again, a lot from the Sierras, Lake Tahoe, streams, rivers, that we are also used in how we design and feature Sierra Medical Center. This is Sierra Medical Center. It is, again, the latest, has the latest technology, state-of-the-art facility, and will encompass those hues, flavors, and designs of the Sierras. You can tell by its colors, and again, this is a rendering. When you get it fully built, it's even more impressive. To have those dark blues, the greens, the hues, the grays, the granite type of feel of what Sierra means. In this design, you'll see it's a 4-story tower with a lot of wraparound services on the first floor to provide the critical care components, the ER, the ORs, and all the other services that will be here. This is one of the patient rooms. These rooms are designed, and again, this features our 100% commitment, not only at Northern Nevada Medical Center of 100% private patient rooms, but also here at Sierra Medical Center, the second hospital to provide its 100% commitment to 100% private patient rooms. And so I always think about if I went on a vacation, well-planned vacation, and my wife and I went to our hotel and we got to share it with somebody else we didn't know. Healthcare is much more intimate and important that we have 100% private rooms. And I actually want to give kudos to, again, our leadership at UHS for committing to do so. These rooms are designed with safety in mind, quality, and as you as a provider, a number of providers, you can see the importance of private rooms. And these rooms are designed with also a larger size that addresses those safety needs as well. This is one of the renderings of a lobby. You can see the hues, the tones, and the colors of the Sierras that are embedded into this. The only thing I don't like about this is it has an administrator with hair. And my children make fun of me all the time about that. Another rendering of a lobby, and you can see that healing environment as it means to us to take a hike up or a bike ride on the Flume Trail or something like that. You know, that's the same healing environment we'll provide. So, what do you think? So again, upon completion, Sierra Medical Center will maintain that commitment to our private rooms, along with NNMC, Northern Nevada Medical Center. We also will be introducing some new services that are unique now to our health system. Here at Sierra Medical Center, we will feature a Women's Health Institute, really designed for the full services of women's health as well as families, and we're very committed to that. That will include NICU, pediatrics, as well as the most latest technology for delivery. Also, you may know that Northern Nevada Medical Center, then Sparks Family Hospital, used to provide labor and delivery services. I don't know if anybody here was born at Northern Nevada Medical Center. Is anybody born here? Okay, we got one. Okay. So we're reintroducing that here at Sierra Medical Center with the highest technology and comfort for our patients. So we're excited about that. In addition, we'll have advanced neurosurgical and neurological care and the inclusion of the latest technology. Again, working with our local providers to make sure this happens. Also, an expansion of our cardiovascular services at Northern Nevada will come here and provide, again, advanced technology and services, including heart surgery, and we're very excited about that to support the heart health of our community. And advanced oncological services in collaboration with, again, local physicians and providers to ensure that these are experts in the field that reside and are committed to provide that care. These are services, along with all other services here at Sierra Medical Center, will provide an extension of what we currently provide. We'll continue to raise the bar in finding new ways to provide health care in the best and safest ways, and it will be innovative. I think it's interesting that the Sierra Medical Center is actually located here on this site, which is intersected with Innovation Drive. So I think that's very appropriate for us to have Innovation Drive at Sierra Medical Center. And in addition to that, Sierra Medical Center will be the home for 2 medical office buildings, which will house our institutes of care and will allow our local physicians and providers to make that home for the growth of their services. This project will conclude in just over 2 years and will open in 2022. And as we begin construction on this project, we'd invite you to follow our progress at nnmc.com. That's nnmc.com. I invite you to say that 3 times fast. So building this new and amazing facility is just part of our commitment. UHS, our parent company, and us here locally, we're very committed to the whole well-being of our community. And I think it's important to know that Nevada ranks 48th in the United States for primary care access, so 48th in the United States, showing primary care providers per population base. We need to change that. So with that, we will grow primary care through our medical group and adding new providers, in addition to support and encourage the growth of UNR Med, and we appreciate their commitment to our community and our region. as well as independent providers that we work with collaboratively with the Silver State ACO. What that means is it's an organization that we work with and contract with to provide better access, care, and outcomes for our population, as well as Prominence Care Centers, which already provide some outstanding services in our community. In fact, Prominence Care Centers also already provide some unique ways of providing care, such as TeleDoc, which is a telehealth service that you can access a primary care anytime, anywhere. Also, I wanted to ensure that we understand that this is really just a strong commitment to this integrated system. And we could not be here today without the many partners and organizations that have supported us. And so again, I would like to take a moment to highlight this. Universal Health Services has really been the driver of growth for actually healthcare, not just in this community, but all throughout the country, with hundreds and hundreds of hospitals for mental health as well as acute care. And in this region, it's the largest provider of healthcare in our state. And so, again, recognizing Alan B. Miller, our founder and CEO, who's really just spearheaded this over 40 years ago in this state. Also recognizes dear wife, Jill. So grateful that you came to make this journey. Also, again, Mark Miller, Mark Miller, president of UHS, Marvin Pember, the president of the Acute Care Division for UHS, and Carla Perez, our regional vice president. So thank you so much for being here. Also want to recognize Roselle Charlier. She's wanted to make sure we got this thing off underway and an amazing event through Jamie, and as you can see, this is an amazing, amazing event, so thank you. Also, our community providers, who equally are paramount to our success, and I'd like to name a few of them today. John Kroponik from KLS Planning, Doug Flowers and Doug Thornley from Holland and Hart, Jamie Crane and her team from Ensemble, just essential. Reno Engineering, Loomis Engineering, Headway Transportation, and other members of the planning group, and all of the staff who are committed to this process. In addition to our community partners helping us and revolutionize this healthcare within the region, we'd like to recognize and give special thanks to our local, state, and county officials, Ward 2 Neighborhood Advisory Board, SR Construction, and the subcontracting teams, again, almost all of them local and part of our community. Prominence Health Plan, Dr. Thomas Schwenk, Dean of UNR Medicine, thank you for being here. Dean Dow, President of REMSA and his team. Reno Fire Department, thank you. Reno Tahoe Airport Authority, Reno Hospital Partners, Rural Hospital Partners, and Joan Hall, their president. Nevada Hospital Association and President Bill Welch, coalition members, and many, many others who've supported us. So I wanted to give them a really big round of thanks. We also appreciate EDON and their support in the studies that really show the need for the growth in the community. So we appreciate you being here as well, Mike. So really, we all of us have seized this opportunity. We've seized the day to making change in this region, to making this happen for communities. And it's really exciting to see this long-term landscape that we're just about to break ground on. We know our patients need this improvement in healthcare. They need more choices, and they need to trust that they'll receive these outcomes right here in our community. And that's exactly what we're doing here today. Thank you so much.
Thank you, Alan. Northern Nevada Health System will continue to improve the quality of healthcare for Nevadans and meet their ever-growing healthcare needs while embodying the values and principles that are already recognized throughout the community. However, we cannot highlight the future without paying homage to the past. In 1979, Alan B. Miller, along with a team of executives, longed for a new standard in healthcare. They wanted to bring superior quality healthcare services to patients in an environment that their physicians supported and preferred for their patients. From the beginning, Universal Health Services has committed to the well-being of Nevadans. The organization acquired its first facility, Valley Hospital in Las Vegas, the same year it was founded. Over the years, the organization helped redefine the landscape of health services within the state and now joins us to celebrate the groundbreaking of Sierra Medical Center. Please join me in giving a warm welcome to Alan B. Miller, Chairman and Founder of Universal Health Services.
Thank you, Vanessa. I am very pleased to be here with all of you today. We are taking a moment to honor our past, and we're looking ahead to the future. I want to tell you my involvement and the company's involvement in Nevada. It's very appropriate that I mention a departed associate, Dave Bransness. I don't know if any of you remember him. I was with another company. Dave was an outstanding hospital executive in Las Vegas, and I had been involved with him and in Las Vegas for 10 years. And he said, you know, Alan, Reno's a lovely city. You've never been there. The people are lovely. It's destined to grow, and they need a first-rate medical hospital and services. So I accompanied him to Reno, and I said, yes, let's be a part of this. And that was the basis for the founding of Sparks Family Hospital. In those days, it was not very easy to get the license to build a hospital anywhere in Nevada, so we were very pleased to come here. This year marks the 40th anniversary of Universal Health Services, and all year long we have been celebrating our accomplishments over 4 decades. And I'm delighted to be here again in Nevada and to be a part of this special groundbreaking. This anniversary I assure you, I have spoken to our construction people, and, you know, I'm a U.S. Army infantry. I don't much care for these guys anyway. So, they don't get their hands dirty and they make a lot of noise. But I've been assured, and I can assure you, that this is going to be a soundproof hospital. So while you get your care, you're not going to be concerned about what we've had to deal with today. I'm very proud of the reputation we have earned as a leader in the healthcare industry. You know, for 9 consecutive years, UHS has been recognized among the world's most admired companies by Fortune magazine. And Alan has mentioned we have a portfolio of acute care hospitals, very few hospitals like the one you're going to have here. We have, this will be our 28th, but we have a few hundred behavioral facilities, and what I'm really proud of is that we treat and cure and help over 2.7 million patients a year. And we have grown to 87,000 dedicated employees, and they are dedicated to our mission, and that is to make people better. That's number one and number two on our mission statement. That's what we're in business for. That's our purpose. And I believe we do it. And I think that the success we've had recognizes the fact that people understand that they can't get better care other than in a universal hospital. And now in Sparks, which has become Northern Nevada, and now Sierra. That's our commitment to the community. We are committed to the communities that we are in. As I mentioned, we're only in fewer than 28 because we have probably 7 in Nevada, 7. So, in Las Vegas. When we get to a community now, we'll have a whole system here, and we are an integral part of the community. That's supposed to be military. I've seen them, a couple of drinks in the officers' club. I know how the thing works. I look forward to the next chapter being written right here. This hospital is going to be another outstanding hospital that will join our group, and we are so pleased to be in this community with a great management team, and we're all dedicated to the health and well-being of the people of Reno. So thank you very much for the nice welcome.
Thank you, Mr. Miller. As a brief point of clarification, as a follow-up to your comments, during Jessica Palotto's beautiful national anthem, that was actually a flyover tribute to this event, so important to note.
While they were here, they flew over?
They did. That part was intentional. These aren't, yeah. True. Well, now you can envision it, as you will the rest of the future facility. The partnerships that we have heard about today have been built with local providers, and it shows the undeniable support Northern Nevada Health System has as it begins to build a new hospital. One of the health system's physician partners has long served as an advocate for growth and success. Please help me welcome Dr. James Sullivan, Chair of the Board of Governors for Northern Nevada Medical Center.
Thank you, Vanessa, and good afternoon, everyone. I'd like to take a moment to thank both Alan Miller and Alan Olive for their commitment and dedication to our region. We would not be celebrating today's milestone without their tireless efforts and vision for a healthier Nevada. Let's give them a round of applause, please. I can't tell you how happy I am to be here today. It seems like a long time coming, but we're finally here. My journey in medicine began what seemed like a lifetime ago as an EMT in Los Angeles, following a tortuous path, ending up here as a nephrologist in beautiful Northern Nevada. As a nephrologist, I see patients who must manage lifelong chronic disease, debilitating diseases, life-changing diseases. One of the most rewarding things I can do is to help them achieve personal milestones. Often that means helping them live long enough to do that one more thing, that one thing that adds meaning and fullness to their hearts before their disease marches on. That's why I'm a nephrologist. It's also why I align with Northern Nevada Health System and their culture. The caliber of the staff, the dedication to excellence, and the level of care patients receive is remarkable. It is unmatched and unique in our community and so vital. I've been elected by my colleagues to serve in the medical staff for the past 10 years. I've been honored to serve in a variety of roles, formerly Chief of Staff, and now as the Chair of the Board of Governors. And look no further than my story for examples of how committed this organization is to our community. I'm not an employee of Northern Nevada Health System, yet they encourage me in a position of leadership and in a position of partnership to speak my mind and allow me to be the best advocate for the patients that I can be. I admire their vision. I admire the fact that this organization has committed and maintained investment in the well-being of our community for the past 4 decades. Our region deserves superior services, and as we grow, healthcare will be at the forefront of that development. The introduction of Sierra Medical Center will increase, in a positive way, competition and patient choice in this area. As a chair of the Board of Governors, but more importantly as an independent community physician, I am excited to see Northern Nevada Health System expand in our area and continue to set benchmarks for the standards of quality care, patient satisfaction, healthcare outcomes, and employee engagement. Today, we not only celebrate the expansion of the health system with this groundbreaking ceremony, but we highlight the unmatched patient and provider experience that Northern Nevada Health System already provides. Sierra Medical Center will dramatically change the landscape of care in this region, and I look forward to seeing all of you when they open the doors in just a few short years. Thank you.
Thank you, Dr. Sullivan. Is anyone else getting goosebumps about this? Throughout their journey, Northern Nevada Health System has had the pleasure to work closely with elected officials from the City of Reno and their staff to bring Sierra Medical Center to reality. Please join me in welcoming Vice Mayor Naomi Dewar to share a few words with us.
Well, a great good morning to everyone. As you can see, I came dressed for a old-fashioned Western groundbreaking. Looking forward to getting that shovel out. Before I move on, I just want to acknowledge my colleague here on the council, Oscar Delgado, who serves with me and is also in the healthcare system as CEO of the Community Health Alliance. So thanks for being here too, Oscar. It all started with the first meeting with Alan and his team. They met me in a very modest coffee shop, and they laid out a vision, an unbelievable vision, of a new medical center with cutting-edge technologies, with unique services, and you saw solo rooms, which I thought was cutting edge myself. I was ready to check in when I heard. Rather than go on my next B&B, I thought, okay, right at home. I laid out the pros and cons of the site they had selected, which was the site. One of the big pros was great access to transportation on some really major arterials in an area that I would consider underserved for medical care, really, in terms of whether it's an urgent care, a hospital, even x-ray, diagnostic services, and all of that. He promised me all of that would be here. I also have been learning quite a bit about the changing nature of healthcare and the fact that doctors or practices aren't quite what they used to be, where it might be as the focus being on setting up your solo practice. It seems like more today, doctors, nurses, all kind of health practitioners are aligning with hospitals, and they're becoming centers for the medical care versus a place you go when you're just sick, right, and can't get well anywhere else but going to the hospital. But Alan really laid out an image, a vision of healthcare, not just will treat you when you're sick, but will help you get well or, more importantly, even stay well. And so I think we heard a lot about that vision today, and we saw the pictures. We're beginning to believe this reality. I also laid out some of the negatives of the site, whether it was drainage or flyovers. I made sure that I feel like as a job, one of my jobs as a council person is to be really honest about what I think about a spot. People always come for my input and guidance, and so I did that. But on the net, I really thought this was a fantastic location. So proud to have this in Ward 2. Thank you. I'd like to follow that by reading a proclamation from the City of Reno, and here we go. Whereas the City of Reno has need for a state-of-the-art tertiary hospital that accommodates the growing region's healthcare needs as a whole. And whereas the City of Reno welcomes Sierra Medical Center, the first full-service hospital to be built in over a century in this region. Whereas Sierra Medical Center will cut down wait times and improve overall efficiencies while elevating regional health care resources to improve the quality of life for all residents. And whereas the hospital will have the capability to perform complex medical procedures while addressing a full spectrum of healthcare needs in 100% private rooms. Again, totally unique. And whereas once built, Sierra Medical Center will provide quicker access to the high-quality care while placing an emphasis on safety. We have REMSA, our fire departments here, patient experience, and measurable clinical outcomes. Now, therefore, I, Naomi Dewar, Vice Mayor, on behalf of Hillary L. Sheevy, Mayor of the City of Reno, do hereby proclaim Friday, October 18th, 2019, as Northern Nevada Sierra Medical Center Groundbreaking Day. And I'd like to call Alan up if you'll receive this proclamation. And while he's coming up, I just want to say, as good as that proclamation was, and here you go, Alan, thank you so much. As good as that proclamation was, I don't really think it touches on the enormity of what is happening. I had an opportunity just yesterday morning to be at our Economic Development of Western Nevada EDON meeting, where we heard some of the challenges with medical care. You know, things like shortages of nurses, doctors that come maybe for 1 year, get their experience, and leave the region. So I think by having a hospital here and being able to have this kind of center, you told me the people that you want to, entice to come here. Certainly we've got it all going on. But it's so important, I think, with all the growth that we've had with the new housing developments and commercial developments, we've seen nothing like this. And to me, this is really a benchmark and a marker of what's happening to our community. So thank you for picking us. Thank you for expanding here. We couldn't be happier to welcome you to the community with this phenomenal new facility. Thank you, Alan.
Thank you, Vice Mayor Dewar and Councilmember Oscar Delgado for being here this morning. Now I would like to welcome Kira Bracken from Governor Sisolak's office.
Thank you and good afternoon. Unfortunately, Governor Sisolak was unable to attend today, but he sends his best wishes and provided me with a certificate of recognition to present to Northern Nevada Health System. In honor of the groundbreaking of Northern Nevada Sierra Medical Center, congratulations on this new regional hospital and best wishes for years of success. So thank you again for allowing our office to participate in your event today, and congratulations on your new hospital.
Thank you. I'd like to next welcome Nate Helton from U.S. Senator Jackie Rosen's office, who will be also, I understand, presenting on behalf of Bill Chan. So please help me welcome Nate.
Hello, thank you. My name is Nate Helton. I'm here on behalf of Senator Jackie Rosen, who unfortunately couldn't be here today. She is in session in the Capitol, but I'm honored to be here. And thank you to Northern Nevada Health System for including us in today's ceremony. Like Kira, I also have a certificate to read on her behalf, and it reads, Certificate of Special Congressional Recognition presented to Northern Nevada Health System in recognition of the groundbreaking of Northern Nevada Sierra Medical Center. Thank you for providing the highest quality medical services for the residents of Northern Nevada. We wish you many years of success. Congratulations, signed U.S. Senator Jackie Rosen. And as Vanessa said, Bill Chan unfortunately had to leave for another commitment, but I'm honored to also present a certificate on behalf of Senator Catherine Cortez Mastro's office. And that reads, Certificate of Commendation, isn't it? Okay. Okay, all right. Certificate of Commendation presented to Northern Nevada Sierra Medical Center to commemorate the groundbreaking for the region's newest hospital and to thank you for your efforts to improve health outcomes for Nevadans. Signed, U.S. Senator Catherine Cortez Masto. Thank you again for including today, and congratulations.
Thank you. As we close, I would like to recognize each and every team member that made today's celebration happen. Northern Nevada Health System is growing to further support our community's desire for choice and equitable access to health. You should all be proud of your work in helping to transform the region. Your dedication is unparalleled. We invite everyone now to witness the ceremonial groundbreaking of Sierra Medical Center. After the ceremony, please help us commemorate this momentous occasion with a hosted lunch just next door provided by Roundabout Catering. Before you proceed, we kindly ask our guests to just wait a brief moment before exiting the tent. Our medical center staff will help guide you to the groundbreaking ceremony in just a brief moment. I'd like to invite the following people to join us outside to prepare for the ceremonial groundbreaking, and then the rest of us will join, and then we can go enjoy lunch after. Alan Olive, Alan B. Miller, Marvin Pember, Carla Perez, Dr. James Sullivan, Vice Mayor Naomi Dewar. Robin will go ahead and escort this group out. Thank you. Thank you, everyone, for being here this morning. It's lunchtime. Please hope you can stay for the celebration. Muchas gracias por acompañarnos, and I hope you enjoy the rest of your day. Thank you.